Good morning, good morning, good morning, good morning, and welcome to another episode of Jolly's Health Vibes. We're here with you in the studios of Q95 FM radio on this rainy Wednesday morning, ready and set, of course, to bring you a health education program, as we always do, with a little bit of humor, a little bit of vibes. My name is Trudy Christian, and Jacinta is in with me this morning. Jacinta, good morning to you.
Good morning to you. How are you? And good morning to our listeners and viewers. How are you?
I'm good, Jacinta. I am good.
Great.
It is a rainy sort of time. I am on vacation leave from my, main job at the Dominica State College.
Nice.
And so I'm enjoying the little, slower mornings
Right, of
in the
course.
rain.
As you should, recuperate, bask in the moment, go to the beach. Well, when it's not rain, go to the beach.
Yes, the little relaxation.
Yes, of course. We need
Um,
that. We need that.
Yes. Good morning to all our listeners. Over the past few days, I have met several people who have said to me, they always listen to Health Vibes on a Wednesday morning. We have some very constant listeners, some people who are very dedicated to the program. I want to say good morning to them. I know that sometimes you don't call or you don't comment on the social media platforms that we are on of Q95, but you're there and you're listening. Sometimes you may be at work, sometimes you may be, in your garden, in the field, whatever you may be doing, and you just have Q95 on and you constantly listen to Health Vibes. I want to tell you good morning. And if for some reason this is your first time, you just happen to land on Q95 and you're hearing our voices here, I want to tell you welcome to the program. I guarantee you'll come back another week for Health Vibes. So welcome. So to our constant listeners, to our new listeners, good morning. To our social media people, I see you popping on. Those listening on the Q95 FM's Facebook page and on the YouTube channel of Q95 FM. Good morning to you. I know normally you guys shout us out as soon as you come on stream. So I just want to tell our social media crew, good morning, good morning, good morning, good morning. Jacinta, what's going on at Jolly's? Of course, we have had a lot of, new announcements, new things, especially in light of the devastating fire that happened 2 weeks ago, is it now? Last week, Monday. Yes. So, how is it going? What's going on?
Okay, so we are moving along nicely. For those who are not aware, just as yet, on the Great George branch, so this is the branch by All Saints University, we have extended our hours from 6 to 8 p.m. So we are open from 7:30 to 8 p.m. right now. And on a Sunday, similarly, with our mega store from 9 a.m. to 2 p.m. So that's great news, for many customers, in the vicinity of Roseau or do not want to go to the Focoli branch. Right now, we are also in the process of developing a pharmacy area in the wholesale department. It is not ready as yet, so
so hold your horses.
So they are working, very, very hard to put it up so that we will still have two branches
In Roseau.
Okay, so that's great news to our customers. I know many of them are saying, "Boy, I have to walk all the way, to Great George." Those who used to frequent the King George branch, But besides that, everything is moving along very well, and I must say our workers, not just because I'm a worker, like I said on my status not too long ago, that we are very dedicated, at what we do. And then yesterday, Trudy, We on Great George were blessed with kakoti and bakes from one of our customers.
Wow.
She and her husband, made it, and we felt so blessed, and it was because she wanted to show her gratitude, to Jolly's Pharmacy and what we do and what we stand for, and we were humbled by this gesture. And this morning I had my last cup of Kagoti. Kagoti and I are best friends. So thank you again to I don't know if you wanted me to say your name, but you know who you are. So thank you to you and your husband for this gesture.
Very nice. Of course, Jolly is the community brand, the brand that has served the community in unimaginable ways, leading the way always in healthcare. And it's so good to hear that, the customers feel that appreciation
Yeah.
for all that Jolly's does. I know so many people have been patient and so many people have been really, just on board with Jolly's getting back fully on
They
stream.
have. So
So
we are thankful
yes, we
and
want to
grateful.
thank
Yes.
the loyal customers of Jolly's, the customers of Jolly's, for standing with Jolly's Pharmacy throughout. For people who try to contact the pharmacy by phone, the phone number is back up. It was down temporarily,
Yes, it
but the
was.
phone number is back up, and the number is 448-3388. So if you want to contact the pharmacy, you want to ask a question, you want to, whatever it is, the number 448-3388 is back up. 448-3388. 448-3388. That's back up. So, slowly and surely things are getting back to some sort of normalcy.
Additionally, the email address is still not fully operational. So just give us a bit of time
Okay.
while we are continuing to work on this. Okay, so maybe by the end of the week, hopefully. Because I know many people have sent in prescriptions and coming in to say that they sent prescriptions via our email address.
Okay.
So as much as possible, still try to work with your physical prescriptions, like we announced last week. Your physical prescriptions, your medical books, a recent package of your medications, because data from October to leading up to the fire has been compromised. So this will be very helpful in seeing what was your most recent medication or what you're currently using.
Okay.
Yes.
All right. I see we're getting a call. Let me just take this call and find out what. Hi, Health Vibes. Good morning.
Hey, Miss Judy, morning to you, Miss
Hi, good morning.
Jacinta.
Hi, good morning.
Yes, I just want to reach out to you all. I heard Jacinta say that she's going to put another department in the wholesale, which is good ideas, very innovative. I mean, for the past almost 40 years, I've been doing business with the brand Mr. Jolly's. Right when he was around by the other one, the other going out of town. We used to have a little place in the corner right by those Chinese there. That's where you start first. Learn a lot from him sometimes, when you come there. Even I wasn't in the herbal thing as yet, but like you, does give you ideas how to do your measuring. Don't put it below your stomach. Go up to your face, like when you're pouring in the bottle, like when you have certain problems, like eczema, to put your hand in dirty water, put on a glove when you're going in the soil, when you're in cement. Does those little ideas. So I've come a long way with him, and I admire his innovation from a man that come from nothing to make it at the top. That's supposed to be an empire, just humbly, and I just appreciate it. And I heard his son always speaking innovative, and Steve Jolly's, he's out of state. He always speaking very, very big. All I hear he's speaking is big, and I respect him for that, and I like his ideas. I want to sympathize with them, because I never ever get a chance to sympathize. I work with them. I still work with them. Some of my items I make, like the nutmeg creams and the cayenne creams, for some years, you have consumed a lot from me, and I also purchase his empty containers, like the bottles. So I want to trade with him, continue trading with him, just working with him, and I want to tell the son they have to do it better. It's just what happened there now is just to make them stronger, because if you look at where Fresh Market was, there was some fire some time back, and look at how it just got better and better.
Yes,
So
definitely.
Yeah, it's just ideas, maybe, thinking differently, more bigger in industrial. I myself have told him what I think they should do in Roseau as businessmen is go bigger. The government there to facilitate things for them, give them duty free, but I think they should form more alliance. Even getting the boats to carry the things in the Caribbean, because we are market right in Martinique and Guadeloupe there, and I know the French people consume a lot of Jolly's products, for instance, the Ujas oil. Their own security, they have to think so, because you cannot rely on the government to do everything. I told him form alliance with the different business people, not forming alliance to fight the government, forming alliance to help the government.
Thank you so much.
The own boats,
I appreciate that.
And
thanks for the
those kind of things I think he's supposed to be doing. Build more bigger industry, like his chemical plants. Maybe you need to take it out of the city, like bring it up to Glasgow, out of residential area. When you pass up, you go at the top of Glasgow where there have no housing, you put your industry, your chemical industry in those places. Okay. That is own security,
Yes.
You have a cadet corps, in Mahu. Get the government to give them a license to have their own security to help fire service.
Okay.
Themselves can bring down fire truck here, because build their own government. That is all I want them to do as businessmen. And we as a small businessmen too, I think somehow they should help us, because in Roseau we don't even have a place to sell. And we are the people that consume the products. Have a good morning.
Thank you, caller.
Thank you so much.
Love you, darling.
Yes. So thank you. And of course, we have a packed program planned this morning. We do have a guest in studio who I have been chasing this guest for a while to get on Health Vibes. And so I'm very excited this morning that we have her in studio. Very busy person. So what we're going to do, we're going to take a quick break. And when we get back, we're going to introduce the guest and introduce the topic. Of course, if you're on social media and you've seen the flyer, the promotion for the show, you know who we have in studio. If you're looking at us, you know who. But if you're not, now is the opportunity to tune in or look at the show live and make sure that you are ready and waiting. When we get back, we're going to introduce our guest and we're going to introduce our topic for today's show. Yes. We'll be right back.
Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen and co-hosts pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. www.jollies.gm. Jollies Pharmacy, leading the way in healthcare.
Oh, and if they say convenience can make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, no me, nigga. You could be shopping and having fun. Shop with your brother, with your son. Shop later to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, no me, nigga. You could be shopping and having fun. Shop later to everyone. What a happy place. Oh, what a happy place. But just stick some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongolia, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
You woke up this morning feeling with sleep. I had the impressions of calling sick, but I end up in Jolly's Pharmacy. You can go to the street, Jolly's fix up my immune system. Me feeling fit and strong now. I'm not the work I can any mission. If you see me again, Jolly's Pharmacy is number one. Jolly's forget. We cater for everyone, Jolly's for you. The immune system, Jolly's for you. Yo, Dominic, it's about Father Box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
And we are back with you. As promised, we have a guest in studio and we have a very interesting show lined up. Now, just in fact, at the start of the year, when we were going through, some of the things to consider about your health and the checks that you need to do, one of the things we ended up talking about is eye care.
Yes. Because we know how important our vision is.
Yes.
And many people come to us for all types of treatments and different types of eye conditions. So yes, our eye health is just as important as the rest of our body.
Everything else. Yes. And it's something that is so critical.
Of course.
And we really said at the start of the year, okay, we need to get topics on stream this year to do with vision, to do with eye health.
Yes.
And so gracing us today on Health Vibes is an ophthalmologist, a dear friend of mine, and her name is Dr. Nancy Lawrence. And she, as I said, I have been wanting her to be on this program for a while, and she has finally made it in to the studio and on to the program of Health Vibes. And this morning we've invited Dr. Lawrence on to talk not just in general about eye care and our preserving our vision, but to talk specifically about glaucoma. And it is a special week as it relates to this particular disease and the awareness surrounding it. And so we decided it's the best time to do that. Dr. Lawrence, good morning to you.
Good morning, and thanks for having me on the invitation, Tracy and Jessica. And even before I begin, I wanted to take a moment to extend my well wishes to the sponsors of this show, Joy's Pharmacy. Joy's Pharmacy has been a pillar of healthcare in Dominica for so many years. And my heart goes out to the company, the staff, the owners, following the recent fire. We look forward to seeing them rebuild and continuing the vital service that they provide to Dominica. And as the caller said before, we want to see you get even bigger and better as you rebuild.
Thank you so much for the sentiments. And yes, that is the plan. Bigger and better.
Yes.
I'm not 100% sure that Dr. Lawrence was coming through loud and clear. She did just extend some well wishes to Jollies and those affected by the fire. Dr. Lawrence, can you try again? Let's see if the mic is working now.
Yes. Should I use this one?
Yes.
This one, is it clear now? Yes, better?
Yes, that's better.
Okay. All right then. Thanks. Okay.
Yes, Dr. Lawrence. So as I said, we have been wanting to talk a bit about eye health and, some of the things that affect your vision or can affect your vision. And specifically, we said this show will focus on glaucoma. Before we even get into that, though, I wanted you to give us a bit of insight into what is it that you do as an ophthalmologist? What does an ophthalmologist do? And what do you encounter on a day-to-day basis in your practice of ophthalmology?
Okay. So first of all, an ophthalmologist is a medical doctor who specializes in eye care, treating eye diseases.
Okay.
So we go through medical school just like your general doctors do, and then we specialize in eye medicine and surgery. So an ophthalmologist is able to diagnose various eye diseases, treat them medically and surgically. And that's different from an optometrist. The training for an optometrist is a bit different. And they, at the end of their training, they can also diagnose and treat eye conditions. Many optometrists work prescribing glasses and contact lenses, but they're unable to do surgery. But they can manage medical diseases like glaucoma with eye drops and stuff like that.
Okay.
And that's also different from an optician who fits eyewear, and they can also make eyewear like lenses and stuff like that. So they're little distinctions, big distinctions.
Thank
I
you.
guess. Yes.
So
Thanks for
an
clarification,
ophthalmologist can do surgery.
Yes.
And how often do you get to do surgery on the eye?
Oh.
I work at a hospital, Brenda Stratford Foundation Eye Center, and we do surgery once a week at the
Okay.
hospital.
Okay.
Yes. And I do surgery from time to time privately as well.
Okay.
And I can imagine maybe, well, I have never had an eye surgery, but I can imagine it
No.
might be a particularly scary thing.
It is very scary, especially if you are not really aware of what to expect. Most of the surgeries we do are cataract surgeries by far, and we numb the eye, so it's not a painful procedure, really, for most patients. Yes.
Well, I as well, like Trudy said, I've never underwent eye surgery, but my mom did in Cuba.
Okay.
It was not the most pleasant experience. I will not go in detail, but she did feel. Let me just leave it at that. But I know that, as you mentioned, many people would undergo for various reasons. And if I had to undergo eye surgery, I think I would be a bit anxious because,
Yes.
it's eyes,
Yes.
Understandably so.
and
Yes.
you don't know what the end results would be. But you're hoping for the best. And I'll tell anyone who has to undergo eye surgery, try to be calm, have a conversation with your doctor if possible as to what to expect, what will be done, so that would at least lower your anxiety level, and they would give you the reassurance
Yes.
of the importance of the surgery and what you would expect from it. I always say communication is key.
Yes, I agree. Yes. And so, yes, I agree that education helps. So, understanding what's involved,
Yes.
understanding that you will be receiving anesthesia, that helps you to hopefully feel a bit more
Of course.
comfortable.
Mhm,
Yes.
mhm. And I know, of course, of the five senses that we possess as human beings. Vision is one. Seeing is one that is so, a lot of focus is placed on that in
Of
terms of
course.
your ability to just navigate the world. Vision is very important. So a lot of people, I can assume, would be very scared when anything is wrong or
Yes.
Yes.
apparently wrong with their vision.
Yes.
And so one of the things we wanted to talk about, or the topic of today's discussion, is something which I am sure impacts quite a few people, and that is glaucoma. Dr. Lawrence, it is World Glaucoma Week. You sent me a very informative link about World Glaucoma Week. I see it celebrated March 8th to 14th. And I want to know from you, what is glaucoma? What and why the specific focus on glaucoma, so much so that we have a whole week for
recognize it.
awareness about this condition.
Okay. So first of all, glaucoma is a group of eye diseases that result in damage to the optic nerve. The optic nerve is the cable that connects the eye to the brain. So it's very vital in being able to see. And when it becomes damaged by glaucoma, it causes irreversible blindness. The thing is that glaucoma can be treated if it's diagnosed early. So it's a preventable cause of blindness. It's actually a leading cause of blindness. It's very prevalent in Dominica because one of the risk factors is race. It's more common in blacks than any other race. And yes. So World Glaucoma Week, which is celebrated every year, the second week in March usually, is to raise awareness in the general population about glaucoma and to try to get people to come in to get tested. A lot of people don't understand that even if you don't have a problem with your eyes, you should have your eyes tested.
Exactly.
Yes. So like all three of us, we wear glasses. We are under the care of some eye doctor at some point in time. But many people who have 20/20 vision don't know that they need to also check their eyes. The most common cause of glaucoma is called primary open angle glaucoma, and that's the type that's most common in our population. And it's most times it's asymptomatic. So you're not going to feel pain, you're not going to notice blurry vision, you're not going to feel any discomfort in your eyes. The vision may be lost gradually over a long time. And with glaucoma, the vision loss is usually peripheral first. So while you're having this very slow process of vision loss in your periphery. You don't really notice over time. And some people present to us very late. And when they do, a lot of the time, it's not uncommon. I see this quite often where people present to the doctor for the first time and they're already legally blind from glaucoma. And that's because of the chronic nature of the disease. It's happening very slowly. And glaucoma is actually called the silent thief of sight for that reason. And so it's very, very important, whether you feel you have an eye issue or not, especially if you feel you don't have an eye issue and you've never seen an eye doctor, that you have your eyes tested for glaucoma.
So you mentioned about peripheral vision.
Yes.
I'm sure many of our listeners may not know
Yes.
what this means. Could you expound a little?
So your peripheral vision. So vision is not just the 20/20 straight ahead vision. Visual quality includes your visual field, how wide you can see.
Okay.
If you're focusing on an object in the center, you have to have some side vision. And that's important for navigating the world, for driving, and for day-to-day activities. With glaucoma, the side vision goes first, usually.
So that's what you refer to as the peripheral vision.
yes.
Side vision. Okay.
Side vision goes first. We're not paying attention to that side vision. Most of the time we use it, yes, but if it's being lost slowly, we make small adaptations. We don't notice it's going until the vision loss comes to the center, and that's when it starts really, really bothering us. So that's what I meant by peripheral vision, and that's why it's a very asymptomatic disease. Because
And interest, and you said it's referred to as the silent thief of sight.
Yes.
And
That's appropriate.
Yes, it's very interesting because I mean, of course, we talk about, for instance, hypertension, the silent killer.
Yes.
And I've never heard that glaucoma, can be referred to as the silent thief of sight. I always thought that there would be some very apparent signs that you would notice. So that insidious nature is I think important for people to understand.
Yes.
So they understand the importance of checking on the eye. I wanted to ask though, Dr. Lawrence, you did mention that race is one of the risk factors as it relates to glaucoma. Any other risk factors why we see it so commonly, and why you did mention in our population the primary angle, you said it is?
Primary open angle glaucoma.
Primary open angle is most common. Why?
Yes.
What are the risk factors that we are presenting with?
Okay, so there are different types of glaucoma. There's the primary open angle, as I said, which you repeated is most common in our population, and that's the one that's usually asymptomatic. There are other types which may be more symptomatic, and they're more common in Asian populations and other races. There are other types as well. There are other ways to classify glaucoma as well. The risk factors for primary open angle glaucoma are multifactorial. The cause of it, I should say, is multifactorial. There are many risk factors. We believe there's some genetic associations. So that's why we see it more common in certain families. So a risk factor would be having a first-degree relative, a parent, a sibling, a child who has glaucoma. So that's a very important risk factor. And other risk factors, well, actually, the most important risk factor is the eye pressure.
Yes.
And we say that is a risk factor and not a defining factor, because not everyone at presentation or even in the course of their disease has high pressures. The pressure is just a risk factor. But for some people, they may have normal pressures and still at the normal pressure develop damage to their optic nerves. Other risk factors include myopia, nearsightedness, for primary open angle glaucoma. Certain medications, steroids can induce glaucoma, and not just topical steroids in the form of eye drops, but steroids in any form. It could be inhaling steroids for asthma.
Right.
It could be creams for eczema, chronic use. It could be medications you take for whatever condition, autoimmune conditions. They can affect the eye, and glaucoma is one of the things that can happen when you're on steroids. Trauma can cause glaucoma as well. So if you've had previous eye injuries, that is a risk factor. Yes. Age is another important risk factor.
I wondered about that. Okay.
Yes. So we see it more commonly in people over 60. But I have had quite a few patients, many patients actually, under under 60, and some even under 40 with glaucoma. And some of them, even under 40, presented very advanced. So we should still have our eyes tested even if we're younger patients.
And wow, that's quite a number of potential risk factors.
Of
We're talking
course.
genetics, we're talking age, we're talking any trauma,
Injury.
Yes.
we're talking use of steroids.
Medications.
Yeah, so it's quite a number of things that could possibly predispose or allow somebody to be at risk for glaucoma. How often should somebody be testing or checking their eyes?
It depends on the age. We recommend that children have the eyes. Well, glaucoma, we're not really thinking. Glaucoma can happen in children, yes, but it's usually a different form. It's not
Okay.
the primary open angle glaucoma. But just about eye screening in general, we recommend that children have the eyes tested just before they enter primary school, preschool.
Okay.
So around age 4 or 5, they should have the first eye test done. Children should also, throughout their school years, get tested every 1 to 2 years or so, because children generally don't complain when they have eye problems. We have a child health program that's done at the schools. The nurse does screening at kindergarten age and grade 6 age, and they refer any patients that have any reduced vision or anything wrong with their eyes. They refer them to the hospital. But also between those ages, they should be being checked at least once every 1 to 2 years. In adulthood, we recommend maybe the same 1 to 2 years as well. Of course, if you have any eye problems, any concerns, you should be seen. And some people require screening more often than that, depending on what's going on with their eyes. Definitely from age 60, yearly exams are generally recommended. Yes.
Okay.
So I have 2 questions. The first, if someone is already blind, do you still recommend eye examinations to see whether there are any other vision problems, or well, not vision problems, but eye problems?
So blind can mean a lot of different things to different people. Some people think blind is not being able to function, and other people might say blind is not seeing light. There are different degrees of blindness, and for a normal person, somebody who can only maybe see shadows might be blind, but that's still good, not good vision, but it's still vision.
Okay.
So if you have reduced vision for another reason,
Right.
I think we should still have your eyes tested, because if you have any other conditions, they can make the vision worse. The vision could probably become, so if we test the vision in different ways, we usually use the eye chart. If you're not able to see the eye chart, we might grade you as counting fingers.
Okay.
If you can't count fingers, we do hand movements, and it can get worse from there.
Okay.
But somebody might think counting fingers is not important, but yes, counting fingers
of
is
course
still,
it is.
you're legally blind, yes, but you can still navigate the world. You still have something to lose in terms of your vision. So we don't just disregard these patients.
Right.
Because you can still, we have patients with glaucoma and their vision is counting fingers. We still try to save the vision by keeping the pressure as low as possible. So yes, I think, if your vision is no light perception and you're comfortable, you probably don't need to have your eyes tested as regularly as another person. But generally, we still recommend eye testing for people who have visual impairments. Yes.
Okay. The second question is related to a statement that you made. You did say that persons with 20/20 vision should still have their eyes checked. And I make reference to what I see at the pharmacy, because we do sell reading glasses, at Jolly's pharmacy. And individuals may just come in and say, well, it's just trouble reading fine print.
Yes.
And they run to get a pair of glasses that would assist with reading. But to those individuals who have just reading glasses and have not tested recently, what would be your recommendation to
Yes.
them?
I would recommend that they have the eyes tested by an eye doctor. We have no issues using the reading glasses over the counter. We actually recommend them for
Okay.
many patients over 40. You start needing reading glasses, and that's normal. That's a normal process of aging. So there's no problem with that, with purchasing glasses over the counter. But you should be under the care of an eye doctor. You should be having your eyes tested regularly still.
Okay, and then I said two, but I have one
You
more
have a
question.
third.
Sorry.
That's fine.
Again, I'm going based on what we see on a regular basis. So just today is Wednesday. So on Monday, a young lady came in and she presented some redness. So if you just pull the lower lid, the inner lid was a bit red, and she said she woke up with it. We were trying to go through options as to why it became this way, whether an insect bit her overnight, whether she was allergic to anything, whether she had an eye injury. And to all of what I just listed, the answer was no. So I did recommend her seeking a professional help in terms of her eye checkup. But for the regular customers who come in with probably swollen eyes or eye irritations and have not had their eyes checked regularly, it's a bit of a concern to us. And yes, we do sell over-the-counter eye drops with what I just listed. So if you have any dryness, irritations, swelling, but I still feel in certain situations that it may not be sufficient to just pick up, an eye drop on the over the counter. So my question to you is, when is it most appropriate to visit a professional like yourself rather than just picking up an eye drop over the counter?
Okay, so apart from your regular eye exams, which you mentioned you need these regular exams, if you have a small problem like some swelling that just started, some minor discomfort, definitely over-the-counter drops are fine to use. The issue is if you're using them and the problem persists, at that point, then you should see an eye doctor. So it depends on the issue. It could be maybe just give yourself at least a few days or so. And then if they persist or if they get worse, you definitely should see an eye doctor at that time. But at first, the first stop, depending on the issue, over-the-counter treatment is fine. The only thing I would say, the only caveat here would be, cases where you have some vision loss. If vision loss is an initial presentation,
And
significant
pain,
vision
pain.
loss, pain, you could have pain for different reasons. Sometimes dry eyes can cause some discomfort and pain, but if it's severe from the start, then you should probably see an eye doctor right away. Yes.
Okay, thank you.
I want to go back a bit. You mentioned, Dr. Lawrence, high pressure in the eye being one of those factors that might, present itself, and the glaucoma diagnosis might, come later. We often talk about high blood pressure. So we know, okay, if most people understand, if blood is flowing through blood vessels, flowing at a pressure, an elevated pace, and pounding against those blood vessels, we consider that to be high blood pressure. What is high pressure in the eye? When we talk about high pressure, what are we talking about? I've often heard these two things sort of mixed, but what specifically does it mean? What in the eye is at a high pressure? What are we talking about? So let us go through the little anatomy of what is happening if there is high ocular pressure.
Yeah. Okay, so that's a very good question, and one that we've had patients ask many times before. The eye pressure is not directly related to the blood pressure. The eye pressure is a result of a fluid in the eye called aqueous humor. That's different from the tears. It's completely different. It's produced inside the eyeball at the front of the eye, and it drains out from inside the eye. Okay, in an area called the angle of the eye, the trabecular meshwork. So that when we talk about high pressure, we talk about the intraocular pressure, which is a result of the aqueous humor in the eye. So if it's like a plumbing system, the pressure in the eye is a result of a balance between the production of aqueous humor and the drainage of aqueous humor from the eye. In glaucoma, we believe there's an issue with drainage of aqueous humor in the eye. And that's where we have the distinction between the open angle and the closed angle types of glaucoma.
Okay.
In open angle, which I remember I said that's the most common type we have in our population. When we look at the angle physically on an exam, it looks open. However, we believe there's some resistance to flow somewhere along the system that we cannot see. but it's open to our eyes. It's open physically. In close angle, when we look, it's narrow.
Okay.
Okay, it's like physically close. Like if you think about a drain, if there is resistance and blockage of the outflow, you get an increased
Build
pressure.
up. Yes.
Yes. So that's what we mean when we say the pressure inside the eye is high.
Okay.
We're not talking about blood pressure.
Blood pressure.
There is some relationship with and hypertension is a risk of for glaucoma, but it's not a direct relationship. You wouldn't expect that when your blood pressure is high, your eye pressure will be high as well. It doesn't really work like that.
Okay.
But there is some correlation there.
Yeah.
Yes.
I think that's important to understand. I've even heard, an ad. It's an old ad, but it somehow kind of correlates, direct correlation, high blood pressure and high,
I think I know what you're talking
yes.
about.
And I've always said to myself, that information there needed a little tweaking.
Yes, I think I know what you're talking about.
Yes, in that ad. But so it's good to get that explanation from you, doctor, about what we mean when we talk about pressure in the eye. I want to know now, somebody comes in now for a test. How do you measure the pressure in the eye? So I want you to go through the whole diagnostic process of, because we talk about going for an eye check, or you need to check your eyes regularly. What does the patient experience when they come in and you have to test the intraocular pressure, you said?
Yes. So the assessment for glaucoma begins way before we even measure the patient's eye pressure.
Okay.
From the time they walk in the room, we see how they walk. You can tell when people are navigationally impaired.
Interesting.
When they have low peripheral vision, we can tell based on how they navigate, how they move.
Wow.
So
I never thought the doctor was observing you from entry into the room.
We all are trained as doctors to observe patients from the first encounter. So we're not waiting until you sit down in the chair. We're looking at you, the way you enter, the way you move, and we can gain some information from that right away.
Interesting.
And okay, so on the exam, so the encounter involves the history. So we look for risk factors like what we discussed before, also what the patient is complaining about. Remember, because of the peripheral vision, patients might mention to you that they're knocking into things, that they've had near accidents, that things appear before them suddenly and they don't notice until it's too late. Things like that we get on the history. We look for any history of trauma, family history of glaucoma, things like that. And on examination now, we look at their visual acuity. And when it comes to we also check their pupils. That's another important thing that we can get information from, because the pupillary response is a result of the nerve function. So we can tell some information from that as well. When it comes to the eye pressure, we have different ways of measuring the eye pressure. Depending on what doctor you go to, it will be maybe measured differently. The machine we have at the hospital right now is called a pneumotonometer. So it uses an ear puff. I cannot tell you the exact physics, but basically based on the response of the cornea, which is the outermost clear layer of the eye,
right.
Based on the response of the cornea to that ear puff, it correlates with the amount of pressure inside the eye. Right. There's also rebound tonometer, which is what I use in my office. It has a small probe and it very gently hits on the cornea and rebounds. The force with which it rebounds can give an idea of the pressure in the eye. And then there's another way there are other ways too, but there's another way of measuring called the Goldman applanation tonometer. And that's one where we will put a little dye in your eye, a yellow dye, and we have a little prism attached to our slit lamp, which we examine with, and that gently touches the surface of the eye. We can adjust our dial and get what the pressure is. Right. Basically, what it's doing is pressing on the eye. It gives you can see some rings when you look through.
Okay.
And we adjust the dial until the rings line up, and that tells us what the pressure in the eye is. So there are different ways of testing the eye pressure. Even after that, not the most important, but very important part of the eye exam is examination of we examine the eye itself. We look to see if there's narrowing of the angles. We can see certain things on our slit lamp examination. We look for other things that might be risk factors for glaucoma. So I didn't mention these two risk factors, but uveitis might be a risk factor, inflammation in the eye that is.
Okay.
Very advanced cataracts, depending on their morphology, their shape, they can press on the the angle and close it. So that can be another risk factor. So we look at risk factors when we examine. And then very important part of the examination is the assessment of the optic nerve.
Right.
And that is where that's the site of damage. So of course we need to look very carefully at the optic nerve. And what you see in glaucoma is something called optic nerve cupping. So the optic nerve it looks like a donut, basically. I like to use that analogy. It looks like a donut. The nerve fibers run in the dough of the donut, and it leaves an empty void, in the middle, which is called the cup. And when we look at glaucoma patients, most of them have what we call optic nerve cupping, where the center part, the empty part
That's
of the
supposed to
donut,
be the
the
void.
hole becomes larger as the nerve fibers become damaged around the periphery of the rim. The cup enlarges. So when we look at patients, one of the most common things you will see would be cupping of the nerve. So some people come to the doctor and the doctor will be like, "Oh, your nerves are cupped. You are glaucoma suspect," because that looks very much like glaucoma. There are not many things that can cause this to happen. So when we see that right away, we become suspicious and we then move on to do other tests. There are other features as well. On the nerve examination, you can get hemorrhages on the nerve as the nerve fibers die. You can get other features within the vessels as they leave the nerve. There's some blood vessels that run from in the center of the nerve, and then they branch out, and certain ways that they branch might look abnormal. So there are other features as well on examination, but one of the most important things on exam is the assessment of the optic nerve. So we spend some time looking at the back of the eye. From there, if we are suspicious enough, then we move on to other tests to try to confirm the diagnosis.
I want to, Jacinta, I know you have a question, but before you ask your question, we've gone through, what you're going to be looking at. You're looking at the person from the time they enter. You do a visual acuity, which I guess you're referring to the reading of the...
Vision, yes.
Right. And then you spoke about the ways to check pressure. Some of the two you mentioned that touch the cornea. I am going to ask, and then you also mentioned viewing the optic nerve. So I'm going to ask for the potential patients out there, do any of these things hurt? Is there any discomfort? Am I going to feel, bad? Because that is how people determine whether or not they want to do tests.
Yes.
Interestingly, not because of the benefits, but because of the possible, discomfort. That is how the average person thinks about testing.
Okay, so thanks for bringing that up, because it is important, as you said. And I didn't mention with the applanation tonometry, we use anesthetic drops. So that's the one where you touch the prism onto the eye with the dye.
Okay.
But there's nothing on the examination that's painful.
Okay.
There is some discomfort, of course, with the light. When you're examining the optic nerve, you get very bright light focus on the back of the eye for some period of time while we're examining. So that's the main area where patients may experience a little discomfort, not pain, but some discomfort. But the examination is completely painless.
Okay.
There's nothing scary that we're doing on exam.
Okay, so I hope you all heard that.
Yes.
For any screening measure, any test, people have certain fears, and so we want to make sure, and the doctor has explained the process very, very clearly, so it can allay any possible fear you may have of getting your eyes checked. So a little discomfort possibly, but the benefits, of course, are very, very far-reaching. So definitely, we still want to advocate throughout this program that you do your eye checks as necessary. Yes, Jacinta.
Firstly, I would like to say that I'm very impressed with the level of technology used, to examine the eyes. And I have been wearing glasses since I was 9 years old.
Wow.
So I have undergone many examination processes, but I don't think I've done any of what you mentioned. So I'm impressed. But the question that I had was, is it possible for an individual to be diagnosed with more than one type of eye condition at a time? So like I just mentioned, I have astigmatism. So is it possible that I can also be diagnosed with multiple eye conditions at the same time?
Yes, definitely. And we have many patients who have multiple conditions at one time. They're different parts of the eye. The eye seems very small, but it's made up of different parts, and you can develop disease in any parts of the eye. You can have cataract while you have glaucoma. You can have diabetic retinopathy while you have cataracts and glaucoma. You can have multiple conditions in the eye, and that's why we ask patients to have the eyes.
And then can one condition predispose you to another? Or is it a risk factor for another condition?
Some conditions predispose you to other conditions.
Okay.
Yes, the cataracts, as I mentioned, in some cases can cause, very, very rarely, I must say, this is not common at all, but certain types of cataracts can lead to glaucoma. Also, diabetic retinopathy in the advanced stages can also lead to a very severe form of glaucoma. And that's something I haven't mentioned, and it's very important to mention that. So, yes, some conditions can predispose to others, definitely. Yes.
That is, that is very important to know, just in case. So you cannot think, oh, I have that already, so I cannot have anything else.
But in line of glaucoma, though, you mentioned about the open angle glaucoma. I know that there is closed angle glaucoma, and this is more of an emergency case. So with the open angle glaucoma, where there's gradual decline in your vision, close angle is where you have like sudden onset of vision loss, or
yes, there are different types of close angle glaucoma. There is the acute form, which is what I think you're talking about, but then there's also a chronic form, and then there's secondary forms as well. So in the acute form, yes, you can have, so this happens in people who already are predisposed. They have narrow angles to start, but something may precipitate the angles to close off completely suddenly. It can be, it could be medications, certain types of medications, cough syrups, things that cause the pupils to become dilated can cause this to happen. What happens is that suddenly, very, very suddenly, the pressure goes up. It spikes.
That's intraocular.
The intraocular pressure, yes. And it strikes, it's the pressure suddenly goes up. Because there's no outflow of aqueous humor. What the patient would experience then would be severe pain in the eye, redness, blurry vision, nausea, vomiting. It's very severe. And it's an emergency. It's one of the few ocular emergencies that we have. If this happens, we have to immediately try to get the pressure down and try to create some alternate pathway for the fluid to be drained.
But then I have a concern though, for someone who presents all those symptoms, so nausea, pain in the eye, or sudden vision loss, there's headache associated with it.
Usually.
Someone may not think that it's maybe directed to your eyes. They may think it's probably something in your brain.
No, I think it would usually be apparent that it's your eye. The eye is usually red. It's painful. It is, you get the headache on the same side of the eye.
Well then, all right.
It is then nausea. Patients come in complaining of eye pain. So it's not something where you'd probably think it's something else. No, usually it's very apparent that there's something going on with the eye. And in that situation, patients would have to go into the emergency room. It's an emergency, and the ophthalmologist will be called and it will be managed. But it does leave patients with vision loss. Usually. It can lead to severe vision loss because of how high the pressure goes and the severe damage that happens at that time to the optic nerve. Yes, so that is the acute angle closure glaucoma. That's different from chronic angle closure. In chronic angle closure, the angles are narrow; they're not completely closed. They're narrow, so the pressure is a bit high, but it doesn't ever go as high as it goes with the acute type. Yes.
There's something else that I know happens with a lot of individuals who fear having their eyes examined, and that's straining their eyes. So they know that their vision is not the same as before. They're reading a book or they're on the computer on their phone, and it's either they have to bring the screen closer or that they have to enlarge the texts to see better, or even when reading, if they don't have reading glasses, they will strain. You want to take the call first, and then.
Yes. So let's take this call. I see we have callers trying to get on board. Let's just take a call. Caller, good morning.
Yeah, good morning. There was a time I woke up with an eye issue. It was in one of my eyes. It was like fuzzy, like when you're looking through a glass. And I went to an eye doctor, And when I went the first time, I had to pay $100. She looked like nothing. I had to come back the other week. She looked another $100. She looked like nothing. And that happened like for 3-4 times until I said, well, if it's a loan, you have to pay on my account. Well, I stopped and I went to buy a juice extractor and I did my juicing and everything. And I came back 2020. It also said that one of the body parts that isn't washed by people is the eye. And I know that the doctors always say don't put like just the coconut water in your eye because it's impure or whatever the case is. But usually those things work for us as our local doctors would, you wash it with plastic or you wash it with coconut water and then, you could get a relief even from pressure in the eyes too. Also, glasses. I think my mom used to use glasses and she couldn't do without it. And there was a time she didn't have the glasses for a while because it was expensive and whatever the case is. And eventually, right now, she has glasses, but she can do without it because they said that your eyes usually adjust. But when you put the glasses, it prevents it from adjusting. So then eventually, and then just keep getting worse and worse, so you have to get stronger and stronger prescription. So what I guess everything there's a good and a bad. But interesting program.
Thank you, caller. Yes, a comment there on in putting things in the eye or washing the eye with things, and a comment there on glasses. Yeah,
I've heard both of them, and we actually do have patients coming in asking about the relevance or the safety of putting in coconut water. And I would really love to hear your view on that point.
Yes, I know. Sorry, I know. In our population, in our culture, we like to use our herbal medications or natural remedies, and I don't really have an issue with that per se. But I think it does come with some risk. So when we're harvesting the coconut, how we cutting it? Are we using a clean cutlass? Is he outside of the coconut clean before we start cutting open it? There may be some bacteria, some plant matter that we don't want getting in the eye. And I actually had a situation with a patient once that was using coconut water and ended up with a corneal ulcer, an infection in the eye. So I think I wouldn't have, personally, I don't advise using these remedies. I know people really believe in them, but I think there's a risk of infection. And that's my concern with respect to these things. So there's no way to sterilize. I mean, the coconut water itself is sterile inside the coconut, but you have to get it open. So there's some plant matter that may transfer to the inside of the coconut water that you don't want on your eye, especially if you had an injury or something. So it's just a perfect opportunity for bacteria and fungus to grow on the surface. So I generally don't recommend. I don't advise patients to use it, but that's just
so it's up to the user to practice.
Yes, we recommend I would prefer to prescribe an eye drop than these
methods.
These methods.
Okay, and then to the other point, I love that he brought it up as well. The fact that many people have stopped using their glasses, trying to train their eyes, to work without them, so that you don't get, I just said, hooked on glasses. Dependent on glasses. Is there a possibility that your eyes can, I don't know, reform or get back some of its vision? I don't know how to explain it properly, but the fact that he said his mom was dependent on glasses, she stopped using it, and then when she actually started using it again, she wasn't as dependent on it. So is there a way to adapt without it, depending on the purpose of it?
To some extent, I think it's possible to be able to function without glasses. If you have a small prescription, you may be able to do without it. I think one of the issues, maybe not the only issue, but one issue with respect to feeling dependent on glasses is the fact that when you start wearing glasses, you usually see a big difference in your vision.
Oh, yes.
So when you're not wearing glasses, you're managing fine. But from the time you realize, oh, wait, I can actually see better, my vision could become is crisper with the glasses. Then you find that you don't really want to not have the glasses on. It's just a relative thing. You feel you see better with the glasses, and then you feel like you need to, because of that, you need to wear them more often because you feel you see better. So I don't know if you understood, if I
Of
made that
course,
point
yes,
there, but
of course I do. I understand.
that's one of the issues I think with respect to the dependence on glasses. There are some situations where you really cannot train your eyes, because one of the main things that happens as you get older is a process called presbyopia. As you age, and usually happens just after 40, around age 40, the muscle that brings things into focus when you're looking close becomes weaker, stiffer. It doesn't work as well. So at that point in time, you start needing glasses for reading. This is a normal, predictable thing that happens with age. It happens to almost everyone. So it's not something you could really train. You could maybe avoid looking close, but at some point you'll find that you really need to have help. You need the help to read. So yeah, I don't know. I
understand what you're saying,
Yes.
because we do see the difference with
Yes.
our glasses. So thanks for that clarification. What I was asking before we got the caller is for individuals who strain their eyes either through reading, watching the screen, can that cause optic nerve damage?
No.
Okay.
No. Straining eyes can cause headaches and symptoms, discomforts.
Okay.
But it will not have an effect on the nerve. No.
Okay.
It will not.
But it's not
no.
safe to do. It's not advisable to do.
It's going to cause discomfort for you, and for that reason, we would advise you not to. So to have your eyes tested and to wear the appropriate prescription glasses, but it will not cause glaucoma. It will not cause cataracts. It will not cause blindness. Straining your eyes like that.
Thanks.
But it will cause discomfort. Yeah.
Thank you.
Okay, Dr. Lawrence, I wanted to go a bit into, we've gone through, how would you diagnose glaucoma? What is glaucoma? How would you then treat it? So let's go a bit into treatment and what is the general prognosis if you catch it early, as opposed to if you catch it at an advanced stage.
Okay, thanks for bringing that up. So this is what makes all the difference, and actually why it's so important to get the word out, to get people to come into test, because glaucoma, though it cannot be treated per se and cured, I should say, it cannot be cured. It can be treated. It can be managed. And the prognosis, when it's managed well, is very good. So people can keep their vision as opposed to going blind. The way we treat glaucoma, there are different ways. Usually we start with eye drops. But one of the first treatments could also be laser. There's a certain type of laser we can do as well from the start to help to treat glaucoma. And what our goal is in treating glaucoma is getting the eye pressure down. As I mentioned before, the eye pressure is the major risk factor for glaucoma. So the treatments are aimed at reducing the pressure. So eye drops, sometimes we might start you on 1, on 2, we may have to add on and add on. At some point, if that's not working, we might consider laser treatment, or we, as I said, we could do laser from the start as well. But if those two methods fail, the eye drops and laser, then the next step would be surgery. And the surgery is not like cataract surgery, which is curable. It is a surgery to reduce the pressure, to help reduce the risk of progression and vision loss. So it's very important for patients to understand the goals of treatments, because many times we have patients who come in and they have had diagnoses of glaucoma in the past, and they will tell you that they stopped using their eye drops because they were not working. And that shows that the misunderstanding about the goals of treatment. As I said, with glaucoma, the vision loss is irreversible. So when we start patients on treatment, our goal from that point is preventing further loss or reducing the risk of progression. So the vision you start with is not going to get, unless there are other factors like cataracts and stuff, but the damage you have at presentation and when you start treatment cannot be reversed. So when you use the drops, we don't expect you to come back the next week saying that you're seeing better. This will not be the case.
You have to be consistent.
Yes.
Oh, wow.
The point of treatment, the reason for treatment, the goal of treatment is to get the eye pressure down to help reduce progression of the disease. So that's really important. So yes, glaucoma can be managed. Your vision can be saved if you're diagnosed early enough and you're treated appropriately and you're compliant. You use your drops as you should.
Mhm. So you mentioned eye drops, okay. You also mentioned surgery. What is the downtime like for surgery to reduce pressure in the eye? Like what is the recovery sort of period? Is it a major surgery? Is it a minor procedure? What's that like?
So there are different types of eye surgery for glaucoma. There are
Okay.
minor and there are major surgeries.
Okay.
There are some surgeries where we do small procedures. There's some where we could physically try to open up the angles a bit.
Mm-hmm.
There are other surgeries where we create a shunt, a drainage device to help
Okay.
drain fluid out of the eye. And then there are major surgeries where we actually remove some tissue to try to create a channel for the fluid to drain out. And with the minor procedures, which we call mixed surgeries, those ones have a shorter downtime. The recovery is faster, usually a few weeks or so. The more major surgery, which is trabeculoplasty, TRABs, those surgeries are usually more involved and they require more more follow-up and a longer recovery period for those ones. And they require a lot more care as well.
Okay. Let's take some calls. I see we have some calls coming in. Caller, good morning. Hi, good morning.
Yeah, I just want to say I'm a patient of doc. And trust me, I on the part of the eye and the pain in the foot. That lady touch, she has a golden touch. Trust me. I did a surgery by her, and trust me, it went so well that I can't even complain. Yeah, I took my precautions. I did the instructions she gave, and trust me, that lady, she got some God gifted
golden touch.
I just she got a golden touch. Yeah, God have to bless that lady.
Very nice.
Thank you.
Because
Thank
the
you,
way
sir.
she had the eyes I had, I couldn't drive at night because I would have that, anything coming on to me, I'd have to stop abruptly. And trust me, when that lady she did one, there's another one to go. But trust me, I seen so good in that one.
Okay.
So there's nothing to fear when it comes to the surgery. She does it with precision, she does it with timing, she does it. I can't, I'm going to explain. That lady is so unique, Doc, that is it, though. Thank you for everything.
Thank you very much.
Trust me. Thanks for everything, and God have to keep your hand.
Thank you, sir. Thank you.
Okay, have a blessed one. All you listening out there.
Thank you, caller. Let's take another call. Caller, good morning. Good morning. Okay, we may have lost that call, but of course we have a few more minutes. I will allow people to call, of course, and interact with Dr. Lawrence, ophthalmologist, who we have on 449-3095, 449-3096, 449-3097, and 616-4257. If you're trying to reach us from overseas, 305-432-9624. Let's take a call. Caller, good morning.
With the advent of the fact that there are so many people with phones right now, and especially with social media, and what I find happening is some people, instead of watching movies and television, they're on their phone watching movies, Facebook or whatever, and they spend hours on that phone and the proximity to the eyes. Long term, what are the consequences? What can be the consequences where the eye is concerned?
Okay. Thank you, caller, for that.
Thanks for that question. It is a very important question because we are facing a bit of a pandemic with respect to myopia, which is nearsightedness. And this can be, and it is made worse by constant near device use. So one of the main risks of constantly using the devices is myopia. And the risk is not just in terms of needing glasses, especially for children. When you have very high levels of myopia, it can cause changes in the shape of the eye that can lead to pathology. It can lead to issues with your vision later on. So that is one of the major risk factors, especially for our young generation coming up. What I advise sometimes, if there's a TV at home, maybe have the kids or use that constantly near devices. But even better than that, having limited screen time, trying to get them outdoors and doing more activities outside than having them constantly on the phone. Also, I know a lot of parents use the device to help, give them a little free up time. But having very young children on devices is not recommended. There's no reason for a 1-year-old or 2-year-old to be having screen time. That's not necessary. So we try to avoid the screen time because we know that it can lead to serious issues with the eye later on in life.
Okay. We have a call. Let's take this call. Caller, good morning. Okay, you can try again. Of course, we are, winding down soon, but we are here. Health Vibes this morning was focused on glaucoma, but of course, as we wind down, just taking some general questions about the eye and eye care and what's best practice. Okay, let's take this call. Caller, good morning. Caller, good morning.
Good morning.
Hi, good morning.
Good morning. How long someone to take?
How long before? Okay, so how long should someone take to change their glasses? Thank you.
There's no prescribed time for when you should change your glasses. It depends on it depends on the person. So, some people might have their glasses for 10 years. And they might still see fine 2020 with the vision, with the glasses. The glasses are in a good condition. They can continue to use them. Whereas you meet someone who changed their glasses last year and they need to change it again. So it depends on the person and how their refractive status, how the focusing of the eye is changing over time.
And so I guess that's why if you go to the doctor, you have the eyes checked, then you would understand if your vision is sharp enough with the glasses that you have, or if you require a change. Okay. So it's an individual sort of consideration. Yeah. Okay, let's take another call. Caller, good morning.
Hi, good day.
Hi.
I love the program. I've been to a lot of specialists here in my everywhere, and I can tell the listeners that the eye exam doesn't hurt. Sometimes you feel like a pressure on the eye, but it doesn't hurt. And then I can vouch there are a lot of sophisticated equipment at the hospital. I was impressed one day when I went to have my eye checked, and all the tests you're learning about the eye pressure and the whatever. They have some of the very good equipment up there.
Thank you very much. And
yeah.
Oh, sorry. You can continue. Sorry.
No, it's okay. Thank you.
Okay, I didn't even mention about equipment because we definitely have a lot of equipment. Ophthalmology is one of these fields where we use a lot of technology. So I didn't even mention this, but even after we make a diagnosis or if we feel suspicion that there is glaucoma, we do other tests as well. We do certain scans. There's a scan called the OCT scan where we actually look at the structure of the optic nerve and it tells us if there's any damage there. And then we do the visual field test. It's an automated test that maps out your visual field. Again, we talk about the peripheral vision, so it shows us if there are areas in the periphery or even in the center that have no vision. And these tests help us in diagnosing glaucoma and in monitoring glaucoma and managing it over time. Our goal is always to prevent progression. So we do these tests quite frequently so we can compare from visit to visit or whatever period of time whether there has been any progression. So then we know, well, maybe we need to give you some more, treat you with more drops to get the pressure lower. And so it guides us in our management. So we do lots. These are just two of them, but we even do more tests than this. So yes, we have lots of equipment that we use. So thanks, caller, for that.
Yes.
Actually, one last thing before we leave. As Doctor mentioned about the eye drops, and there may be a need for more than one.
Yes.
I really want to urge our patients who are on multiple eye drops to take them as recommended. Unfortunately, some may say, well, I just want the night one I just want the daytime one.
Okay.
And then if you are using more than one type of eye drop at a time, to wait at least 20 minutes in between before instilling the second or third one. And also, hygiene practices are very important. So ensuring that you wash your hands properly before, and avoid having the tip of the bottle touch your eye or your fingertips as well.
Yeah, that's very important, Jessica. And one thing though I want to say, you mentioned very important points, but we usually tell them to wait 5 minutes. And the reason we tell them not to wait 20 minutes is because usually when they wait that long, they forget to put the other one. So we usually say at least, if you can wait longer, yes, but usually say at least 5 minutes between
Just
drops.
to ensure they don't forget.
No, between drops.
In drops,
If you have two drops that are due
Right.
around the same time, let's say you have two different drops that are twice a day.
Right.
When you put the first one in, you wait 5 minutes before putting the second one in.
Okay.
Yes.
No problem.
At least 5.
No problem.
Do we have a call? Yes, let's take
Hello,
this
good
call.
morning.
Yes, caller. Good morning.
Yes. If you have in your eye, your both like me, I have two things in my eye. It's almost touching my what do you call it? The black thing of your eye.
It's a cornea.
Okay.
Before the
Yes.
black.
From this day, when I got up, I realized that when I watched in the mirror, I realized that it's almost touching my eyelash. I heard it.
Okay.
Yes. Do I have to come and see a doctor to check it? Because it's a thing. Yes. It usually comes and goes. It usually comes and goes, but it's in my both eyes. It's like it's a line touching my eye.
Yes.
Eyelash.
A
Yes.
line. Okay, I think
My
what,
eyeline.
yeah, I think what you're describing is called a pterygium, and in Creole they call it a T. And you can see it when you look in the mirror. It's a fleshy growth coming in, usually from the part by the nose, which you call the nasal part of the eye, and it can grow onto the cornea. And if it becomes inflamed, you may notice it more than if it's not inflamed. When it's inflamed, it's red. It might be swollen. You may have discomfort as well. The main factor causing the growth of the pterygium is the UV radiation from the sun. So we usually advise clients to make sure they have on UV protection, sunglasses, when they're outside, or if they have glasses normally, make sure they have the transition tints when you go outside. Other things can cause irritation and growth, like wind, dust, smoke, and other chemicals as well. If it is causing constant irritation and growth, especially if it's starting to grow where it's affecting your vision, then we would recommend surgery at that time. But if it's small and it's not too bothersome,
It's almost touching. Yes, it's almost touching me. And every time I bit my eyes, I could feel it itching.
Yes.
It's almost touching my eyebrow. What do you say? Whatever the lady said. Yes, it's almost touching it. But as it goes and comes, I have 1 year, I don't feel it, 2 years, and then another year, it just come back. It's like a growth that's in my eye. I'm not sure it's the growth.
Yeah. So.
All right. Thank you very much.
No problem.
Yes.
All right.
Okay, thanks, caller. So let us take one more call before we get into Dr. Lawrence, what's going on for Glaucoma Week. I know you wanted to share that specifically at Vive Eye Care. Yes, caller, good morning.
Yes, good morning and greetings to you all in studio.
Good morning.
While I may applaud and accept the modern medicine, but modern medicine got to understand all the ideas they got it from the old school, and so the old school medicine always prevalent. And reason why I said that, I'm listening to you all with the eye issue, and I always ask that question: if someone never get a on their head or in the eye, how come that individual is going blind or eventually have poor vision? And through my travels and learning, a lot of times the food that we eat, for instance, if you have a glass and the glass is dirty, what you do? You take glass cleaner, you spray it and you wipe it. The same way for our body. But what happens is that we have to know the ways and the means, and I learned that through all the holistic cleanses. I had issue with my eye that I couldn't see small letters and numbers until I heard about the urine therapy. And I did that, and it's nothing but mucus that came out. We all know when we go to sleep, we get up in the morning, what we call last C, is nothing but mucus. So a congestion of mucus is what helps is what helps the blurry vision. But if we don't know how, we're just gonna suffer and say we have glaucoma, we have cataract. It's not but a congestion of mucus. We have to find ways and means to cleanse it. And I did the urine therapy, and I know many individuals. I called the radio station one time. Matt hanged up on me, and he said, "Why I'm telling people to drink their urine?" An individual called me from another village, but Dion, what am I talking about? I do the urine therapy. I have friends in the States that does the urine therapy, and I learned it from Dr. Sabi. It helps and it works. So I'm not going against your modern medicine, but it's nothing like the old certain things. We have to keep it like it is, and chemical substances might have allergic reaction on some people, but it works for others. But I think we should do the best and try to learn about the whole, how our parents did it and what they did to help us in this day. But the urine therapy does excellent for people who have blurry vision, to clean the lens under eye from a congestion of mucus in the back of the eye. Thank you,
caller.
Okay, I just want to say something about this. Thank you, caller, for your contribution. However, I would like to let the public know that this urine therapy, I am not too sure what it entails. It's not something that we recommend as medical practitioners. We actually would advise against things like this. Not only, I know you have your experience, caller, with the urine therapy, but firstly, as we mentioned earlier on, there are many different causes of eye blindness, many different issues that can happen with the eye. And this therapy, there's no one hat that fits all different eye problems, right? So there's no one therapy that's going to cause you to get cured from cataracts and glaucoma and diabetic retinopathy. There's nothing of that sort. And the issue is holistic treatments. And again, I am not against, well, I'm against the urine one, but I'm not against them all. The issue with these things are that they're not tested, and there's no evidence that shows that they work consistently in all patients. So we don't recommend these treatments for managing eye conditions. And in fact, it's quite dangerous.
So waste product or urine?
Well, in addition to that,
it's felt to be.
But it's best to use these to treat serious eye conditions that can cause blindness when we already have treatments that work and are proven to work. So you may be using your conventional, your holistic treatments while you're going blind, and so we don't recommend these things at all. Please, glaucoma is a very serious condition. It causes blindness. We see it all the time. It is irreversible blindness. It's not something to take lightly or play around with. And so we would urge you to seek medical treatment. Please don't play around with the other things that we have no evidence for. Yes.
Okay. So, Doc, it is Glaucoma Week. I know you said there's some things going on you wanted to just touch on for this week. And of course, your contact information as well for anybody who might want to reach you, make an appointment, actually follow of the things that you have spoken about in terms of getting their eyes checked and tested and so on. So let us know what's going on from your end.
Okay, so for World Glaucoma Week at Vive Eye Care Center, we are having some free eye screening for the public tomorrow, Thursday, the 12th of March, between the hours of 8 a.m. and 12 p.m. If I got that right. And yes, and so we'll do some screening at my office. It's located at 31 King George V Street. It's opposite Simsey's, on the corner of King George V and Great George Street. We'll be doing screening for the public. Whoever wants to have a free eye screen, we'll be doing it there. And at the Brenda Stratford Foundation Eye Center, which is the eye clinic at the hospital, we will be doing screening particularly for bus drivers and taxi drivers. Those are our target patients, this population this year.
Okay.
And that'll be also tomorrow between the hours of 12 and 30 p.m. So we urge the public, please, if you have some time, to come by and have your eyes tested for glaucoma. Apart from that, though, we are always available. We have the eye center. You could be seen there by referral. Yeah, we do clinics every day.
Okay.
at the hospital. And at my office also, you could call us. Our number is 295-8983 or 448-8983.
You need to say that again, Doc.
Oh, yes, sorry.
The number is 295
8983
8983
or 448 8983.
Okay.
And the hospital also, we are also available. We always, as I said, we do many clinics. To get to be a patient to be seen at the hospital is by referral only. So
Okay.
you would need to be referred by your doctor or by your family nurse practitioner, yes, to be seen. Yes.
Okay. So some free screenings going on this week. So make sure you make use of it. At Vivi Care, it's from 8 to 12 tomorrow, Thursday. You can walk in and get, your eye screen for glaucoma. And also at Brenda Stafford Eye Clinic in the hospital, we're saying that bus drivers and taxi drivers, people always on the road, you really need to make sure that your vision is 100% as best as you can, take care of your vision. So screening from 12 to 2:30 for you, that is at the hospital eye clinic. Yes. And it's World Glaucoma Week, so we just want to make sure you are aware of this particular condition and the ways in which you can or get it diagnosed if you already have it, or if you do and you need treatment, you can do so and get your vision saved or get your vision preserved, I guess is the best way to say this. It is 11:44 a.m. here in the studios of Q95 FM. It is the end of the program. We've taken a little extra time because we did start a little late. And so we are wrapping up. Dr. Lawrence, I want to thank you so much for gracing us with your presence and with all the information, very pertinent information that you provided today to our listening public. I see that people are trying to call, but you're just a little too late. You'll have to catch us the next time we have a discussion on eye care. Or, of course, on any other topic that we do on Health Vibes, we will catch you another time. Jacinta, so signing out.
Signing out. Have a blessed day, everybody.
Yes, and see you next week, God willing, where we aim to bring you another program, health information with a little vibes, a little, a little something. So until then, do have a good week and take care.
Take care.
Charlie's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts Trudy Kristen and co-host pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor, and not forgetting lots of vibes. Charlie's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Charlie's Pharmacy, leading the way in healthcare.
Indulge your senses in the exotic fragrance inspired by nature, luscious fruits, tropical flowers, and mesmerizing beaches with Beef Air Freshener. Flowers of